Before the COVID-19 pandemic, it was almost unheard of for a patient to wait more than a year for specialist hospital treatment in England. Even a wait that long was rare. But as the latest official figures reveal, tens of thousands of patients are now waiting upwards of 2 years for treatment. On Thursday, England's National Health Service released its latest batch of referral to treatment data, which tracks how long patients are waiting for specialist hospital procedures like cataract and hip surgery. The clock starts ticking once someone is referred for treatment, usually by a family doctor. The data show that in January, around 6.1 million people were waiting to complete this kind of treatment. It's not a perfect estimate, as some patients will be counted more than once if they're waiting for more than one procedure. This is an increase of roughly 30,000 so-called incomplete pathways on December, the latest jump in a pandemic that's seen the total number of waiters grow month on month since April 2020. While the overall increase remains a cause for concern, what's more worrying for many health leaders is the rise in patients waiting a very long time for treatment. Earlier this year, policymakers set a target to eliminate 2-year waits for non-urgent care by July. But the new data reveals that in January, almost 24,000 patients had been waiting upwards of 2 years for specialist treatment. Many of these delays will be down to the cancellation of non-urgent care during the most pressurized months of the pandemic. In January, the highly contagious Omicron variant meant large numbers of England's hospital staff were isolating at home. Although case numbers had been falling since the winter peak, the Health Service Journal recently revealed the number of COVID-19 positive hospital admissions started to grow again in the first week of March. It's too early to know exactly how many of these patients are in hospital for reasons other than COVID-19. But the more the disease is circulating, the harder it is to prevent the spread among patients, some of whom will be very vulnerable to complications. Hospital leaders have called on the government to provide costed plans to boost staffing levels in response to the latest data.